See Mohammad Ali, CEO and founder of MyRx365. Mohammad, good to meet you. Great to have you, and I can't wait to learn more about MyRx365 and what you're building. Okay. If you heard the last interview, you might know that we at Startup Health, we like to start by talking about the big motivations behind the startups. So what would you say is the health moonshot, the big audacious goal that MyRx365 is going after?
Well, first off, thank you for having me. Our moonshot is basically to increase patient medication adherence.
Okay.
Right? And the reason why we're doing this is that at the end of the day, the more adherent you are to your medications, the healthier you'll become and you'll stay compliant on your care plan. And so our goal is that.
Okay. How big of a problem is that?
It's surprising. It's a really big problem. Non-adherence is about $300 billion annually. Is the cost to the healthcare system.
Great.
So I mean, if we can even change that, even bring it down by 10%, it's $30 billion a year which you're saving.
It's massive. It's massive. Okay. So what's your tack? What is your angle on improving medication adherence? Because I feel like I've heard a number of different startups, even just today, talk about some piece of that puzzle. So
correct.
Yeah.
So we are a digital pharmacy, and what we do is we provide all the similar tools which other pharmacies do. The standard, you can transfer your medications, see your meds, get delivery, so on and so forth. But what makes us unique is that we actually integrate with medical records. We integrate with wearables, health apps, any form of data which is out there related to you. And we give the patient ownership of those records and really aggregate them together. And if the patient wishes, they can have their providers or their physicians or family members be part of their care plan. And so what that eventually does is it forms a unique data set which no one has, which is a 360-degree view of the patient's health. Right now, if you go to the doctor's office, all he knows is what you tell him or your blood work tells him for those 10-15 minutes. He doesn't know what you're doing for the other 90 days after you left the doctor's office. So imagine if he can be proactive and get involved in your care 10 days after rather than 90 days. So we're doing something which is unique.
Yeah. Okay, so there's the personal data component, the wearables component, and then how does that integrate with the pharmacy tech that you mentioned?
So the way that it integrates with the tech is that now you have a record of your medications, your health apps, your lab work, your medical records, and it's all in one place. And so as you're connected with your providers, with your family members if you wish to have them, there's a social component to it as well. And the physicians can be involved when they see that, for example, if your medical records said you should stop eating fatty foods, and now you are at a fast food restaurant from 12 to 1 every day, and Monday to Friday, there is a way to do an intervention to possibly change your behavior.
Okay.
Instead of waiting 90 days till the next visit.
This app sounded great until you said it was going to start telling me to eat better. No, I'm just kidding. I feel like so critical to have those daily interventions help us with habit change. Really interesting. So here we are at the dawn of 2020. What is it that you're most excited about for this next year?
So this next year is really huge for us. The reason for that is our new app is coming out by the end of the first quarter, I believe, February, March, we should have it out. We're also working with a number of transplant centers nationwide. We're getting pharmacy licenses nationwide as well. And there's a few strategic acquisitions which we're looking at. So it's going to be a banner year, hopefully.
Nice. Is this something that I can download, or is this something, are you selling into consumers or providers?
Yes, our marketing strategy is obviously to providers. We tell them about all the different tools that we offer for their patients, medication therapy management, patient engagement tools, integration, so on and so forth. But you as the patient will be able to download the app come the first quarter of 2020.
Awesome. All right, well, that's the time we have. Thanks for coming down to the TV studio.
Thank you very much.
And best of luck in 2020.
Thank you.
All right, take care.